Hello viewers, if you or any of your family member is looking for benign prostate enlargement treatment without surgery, then this video is for you. I am Dr. Shaileshkumar Garge, board certified vascular intervention radiologist at Citi Vascular Hospital and have performed more than thousands of such procedures. If you are not subscribed to our channel yet, please do subscribe for more such useful videos. So without wasting time, let's see the live demonstration of prostate artery embolization treatment for BPH. Benign enlargement of prostate is a very common problem, and one or other of our family member, elderly family member, do suffer with the prostate enlargement problem very commonly. In this our live demonstration case, he was a patient of 80-year male. He was suffering with the bladder outlet obstruction symptoms of the classical symptoms of the prostate since many years, and he was on urine catheter because he was not able to pass the urine, and this catheter was there since almost 2 weeks, and because of this urine retention he was developing recurrent urinary tract infection. He was a patient, because of his age and multiple issues, he was a cardiac patient with ejection fraction very low. Most of prostate surgeries were contraindicated in him due to the very high risk cardiac patient. So he was left to suffering until he came to know about this prostate embolization treatment at Citi Vascular Hospital. So before our live demonstration, you will just have a view of the animated video of how this prostate embolization treatment is done, so you will get a better idea when we are doing the live case. So prostate is a walnut size of organ gland just situated below the urinary bladder, and as the ages, the prostate gland enlarges and compresses the urinary tract and causes the obstruction to the urine. So a lot of urine get retained, there is recurrent urinary tract infection, bladder gas thickness. Lot of times patient get experience of urinary frequency, urgency. He has to wake up many times in the night, which disturbs his sleep and as well as the sleep of the partner. So this PAE is a minimally invasive procedure for treating the prostate symptoms, and it's performed by the intervention radiologist. So this procedure is done through the hand or the groin, and you see these catheters, they are reached till the prostate as close as possible, and these fine tiny particles are released to block the prostate blood supply. So as the blood supply of the prostate is stopped, the prostate shrinks because of the lack of blood supply, and the pressure on the urinary carrying pipe is reduced, and the patient is able to pass the urine slowly. Now I demonstrate a live case. This is our team who is doing you can see the catheters which you are seeing in the animated video going through the groin in the patient's body to reaching till the prostate gland, and this is our team of experts, and this is an angiogram, live angiogram you can see from the left side from the internal iliac artery, and then we are slowly reaching with this micro catheter into the prostatic artery which supplies the prostate gland. Now you can see the micro catheter over the wire is we are advancing till as close as possible to the prostate gland. So once we are in position, we just confirm that we are in the correct position, and so this is the prostate gland which is supplied by the prostatic artery, and using the fine particles which you saw in animated video, that is 200 micron, we are slowly infusing through this syringe. Once we are in confirm the location of the catheter, micro catheters, through this tiny catheter, then you can see slowly the dye is going, and this is the prostate gland just below the urinary bag. So the PVA particles are slowly given into the prostate gland till there is no flow. Now you can see that there is no flow distal to this branch. So this is how the prostatic artery embolization done on the left side. Now we come to the right side, and there you can see this is on the right side. This is supplying the right half of the prostate gland. Previously it was on the left side. Now you can see the nicely blush on the right side. So this is how the prostatic artery is cannulated on the right side. Now you can see the tip of the microcatheter. It is slowly, the dye is slowly filling the prostate on the right side, and this is the blush because of the gland enlargement. There is a lot of blood is being absorbed into the into the prostate gland. This is the Foley's catheter which patient was there since almost 2 weeks time, and this is the PVA particle infusion slowly, and there you can see nicely we are into the location, and this is how post PVA particle embolization. Now there is no flow distal to the prostate gland. So this is how the prostate artery embolization is done. And so prostate artery embolization for BPH is a safe and effective treatment. It is a minimally invasive, done through the hand or root through a pinhole. Similar how we take the saline infusion in your hand or leg for treating BPH without surgery. So this treatment can fill the important gap between the medical and surgical therapy, because lot of patients, because this prostate problem occurs usually in elderly patients around 60s, 70s and 80s, and most of them, they are suffering with the heart problem, diabetes, hypertension, and in this high risk patient, surgical therapy is most of the times is contraindicated, as in this patient, because of the heart problem, his ejection fraction or heart pumping capacity was only 15%, so he was contraindicated for surgery and opted for prostate artery embolization. Thank you for watching. You can share this video with the people who may find it useful.